All right, it's 2:30. Can everyone hear me? Okay. Thank you for joining us today for the media briefing about COVID-19 in Idaho. My name is Kelly Petroff, and I will be moderating today. Please note that everyone should be on mute unless you are speaking. ASL interpretation is available today. Search for ASL interpreter and hover over the three little dots in the window to lock it in place. DHW's Division of Public Health Administrator Elke Shaw-Tulloch will provide opening remarks along with Dr. Christine Hahn and Dr. Catherine Turner, and then we'll open it up for media questions only. With that, I will turn it over to Elke.
Great, thank you very much, Kelly. I appreciate the introduction. So thank you all very much for being here today. We have some very important information about the latest impacts of COVID in our state that we want to share with you. And for starters, we want to stress that we continue to be extremely alarmed by the increasing trends we're seeing in Idaho with our COVID-19 cases. And as you've seen in previous briefings, the Delta variant is the dominant strain of SARS-CoV-2 virus, and it's continuing to dramatically drive our metrics in the wrong direction. 2 weeks ago, we told you we had not seen numbers like this since January, March of this year. Now we're seeing numbers like our hospitalizations, for example, closer to what we saw near our highest peaks in November and December. Cases have been increasing in every region of the state over the last 4 weeks. Our statewide 7-day moving average of cases per 100,000 went from a low of 3.4 on July 5th to 16.5 at our last briefing, and now we're at 30. Currently, only 3 counties have a 7-day moving average under 10 cases per 100,000. The COVID-19 testing positivity rate has increased from a low of 2.8 on June 13th to 12.3 today. As a reminder, we like to see our positivity rate below 5%. Additionally, the percentage of long-term care facilities with outbreaks is currently at 15.5%. But our biggest alarming concern is what we're seeing in our healthcare system. Dr. Catherine Turner will be following my presentation, and she will elaborate further with some data for you. But my message right now to you today is that the hospitals are completely stressed and in many cases overwhelmed and seeking assistance from state and federal resources. We have been submitting emergency assistance requests to bring the staff in from federal sources, which puts us in competition with other states experiencing the same emergency. We're convening our hospitals multiple times a week to problem solve. We've called also on our Crisis Standards of Care Activation Committee to convene later this week to ensure that they are fully trained on protocols and ready to activate Crisis Standards of Care at a moment's notice if needed. As a reminder, Crisis Standards of Care is when a substantial change in the usual healthcare operations is necessary due to a pervasive or catastrophic disaster. So to reiterate what we've mentioned in previous briefings, it's very concerning that we're seeing this now even before schools are fully back in session, before our flu season turns into full swing, and while we have right now large events like fairs and concerts happening across the state. Dr. Turner will be sharing with you some projections about the fall that are even more sobering. There are solutions, however. We know that vaccines are a safe and effective way to slow the spread of COVID, including the virulent Delta variant, along with following other public health guidance and guidelines, such as wearing a face covering in public settings and physical distancing. Fortunately, we've seen vaccination rates increase slightly for the 4th week in a row, which is very encouraging, but we're still only at 52% of Idahoans aged 12 and older getting at least 1 dose, lagging the nation at 70%. Additionally, the rate of increase in vaccinations has decreased compared to previous weeks, but overall and across all age groups. The age groups with the highest rate are those ages 12 to 17, ages 35 to 44, and those 65 to 74. The bottom line is that we need more Idahoans to take action now and get vaccinated. Last, I would like to follow on some comments made by the governor in his briefing last week about monies he made available for school testing. $30 million is being made available through state public health for public and private schools K through 12 to support their COVID response. Our division is requesting a redirection of federal funds to accomplish this. When that redirection is finalized in the near future, schools and school districts can choose to avail themselves of the funding and design and implement a screening program, a testing screening program that would work best for them. For example, school districts and private schools may choose to implement targeted screening efforts. For example, specifically focusing on staff, teachers only, or student athletes, whatever they choose, or they may choose to screen based on levels of community transmission. The decision is completely theirs. We're making the money available for them. We anticipate awarding grants to schools with a base amount for each school with an additional allocation based upon the number of students enrolled. There are many details being worked out right now, but we will continue to keep you apprised of the progress as we learn more and as we have these weekly press briefings. And now I will ask Dr. Turner to give you additional details on hospital data and her projections, followed by Dr. Christine Hahn to give you additional details on vaccination recommendations. With that, I'll turn it over to Kathy.
Thanks, Elke. Good afternoon, everyone. So I wanted to take a moment today just to share some data about our hospitalized patients that are in the hospital due to COVID-19. So most of you are aware, if you've been watching our dashboard at all, that we are seeing a significant increase in the number of people who are currently in the hospital with either confirmed or suspected COVID-19. And when you look at our data, what you will notice is that we are not just repeating the surge that we saw in the summer of 2020. We're actually beating that surge, and we are inching more towards the surge that we saw last winter. If current projections continue, we could be reaching those levels here in the next few weeks. Along with that, we are also seeing an increasing number of people in the ICU with COVID-19. So these are people who have lab confirmed COVID-19. And if you look at our data dashboard, our Tableau dashboard, you'll notice that we are currently at the peak that we were last winter. So we are almost even with the peak we saw last winter with regard to patients who are in the ICU. And then on top of that, some of those patients do require a ventilator. And what we're seeing in our current data right now is that our ventilator usage is somewhere between the surge we saw this time last summer and then the surge we saw last winter. So the cases are very severe. Our hospitalizations are increasing. And some of you know that there's been some projections that have been shared based on some certain assumptions, primarily the fact that we have a vaccination rate in Idaho of less than 70%. And we have a variant circulating currently that is at least 60% more transmissible than the variant that we saw last winter, and that was the Alpha variant. You'll all remember Alpha. We're now seeing Delta. And based on those two assumptions, the projections that are being driven by the surge is driving our projections upward to about 30,000 cases per week by mid-October. And to put that in context, at our peak daily case count, if we had taken that peak and multiplied it by 7, we would have had about 20,000 cases in a week. So this is beyond what we saw last winter when our cases peaked in December. And along with that, we're also projected to see a significant increase in the incident hospitalizations, or the people who are admitted to the hospital due to COVID-19, and that could be as high as 2,500 in a single week, which again is a lot higher than what we saw during our surge last winter. So between what we're seeing in our data right now, and then what projections are indicating could be our future given our current trajectory and the rate of vaccination and the current variant circulating, it looks like it could be a very grim winter for us, at least a grim fall. And so that's what the hospitals are looking at, not only today, but also what they expect to see in the future. And we can talk a little bit more about that data after the Q&A session opens up, but I'm going to turn it back over to you, Elke.
Great, thank you, Kathy. Appreciate that. And next up, we have Dr. Christine Hahn to talk about vaccinations.
Thank you, and thank you, Kathy. Very discouraging news for us all. I just wanted to mention two recent changes to the vaccine recommendations that I'm sure you have heard at least a little bit about. Last Friday, the CDC's Advisory Committee for Immunization Practices did recommend additional doses for immunocompromised persons. And just to be clear, and the terminology is confusing, I've heard it used differently, but CDC is trying to coalesce around, these are not booster doses, these are third doses for people who have organ transplant, they might be on immune suppressive medication, they may have a inborn error in their immune system that keeps them from responding appropriately. Those folks don't respond very well to only 2 doses, and so the recommendation was made after the FDA authorized this, that they could get a third dose. So we're calling that, or CDC is calling that, an augmented series or a third dose after the first 2 doses of a primary series. And that's different than the booster dose I'll talk about next. So that augmented recommendation went out Friday. Some of you may have seen we did a press release on Friday about that. Also, we got messages directly to our vaccine providers. And I think the main Idaho message we want to make sure everybody is aware of is that this went into effect immediately, and patients that would like to get that third dose certainly can go to their healthcare provider if they offer the vaccine and get it directly there. But they can also go to pharmacies and other locations. They don't need to have any proof. They just need to, what we call self-attestation. They just need to say, I am qualified for that third dose for immune-compromised persons. They don't need to reveal what condition they may have. And we just want to make that clear to people so they don't hesitate. That's an important dose for those folks. We want to make sure that they're well protected. So that's one thing. The other thing I want to mention, I'm sure some of you saw last night that like we did in the Washington Post and the New York Times, the news that the White House is expected to announce a booster recommendation for everyone who has received the 2-dose series of either the Pfizer or the Moderna at least 8 months prior. So again, that has not officially come out yet, unless I missed it in the last hour. It was expected to come out tomorrow. I'll be frank that this is a bit of a surprise. We have certainly been talking about boosters for a long time, but just about a month ago or so, CDC and FDA put out a public statement saying there was no need yet for the boosters. We do understand new data is coming out all the time, and I think what I'm hearing is what swayed the White House's decision was data from Israel, which has shown a loss of vaccine effectiveness over time, and then also Mayo Clinic. There is something in not yet published, but available for review, and that data also suggesting in these in their population showing some waning of protection over time. So we understand that it's a changing landscape. As I think Elke said, beginning things are changing all the time, but the announcement yesterday was a surprise. So we know you'll have a lot of questions about that. A few things I will say is I expect that we will certainly look for those recommendations tomorrow. The Advisory Committee on Immunization Practices COVID Working Group is meeting again this week. We'll be talking about it then. Really, how does that translate into CDC recommendations and so forth. In a way, we have a natural sequence of what will probably happen since you apparently will have to have been at least 8 months vaccinated. So not everybody will be eligible on the same day. It'll require having had those first doses at least 8 months earlier. So please stay tuned with us and bear with us as we catch up and look for those official recommendations from the White House and hopefully from the CDC very soon. So with that, Elke, I'll turn it back to you.
I'll turn it back to Kelly, actually, to take the questions.
Thank you. So now we will take questions from our media participants. Please raise your hand in WebEx or type your question into chat. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. And please remember to clear your hand when you're done. The first one I saw was Melissa Davlin.
Thanks, Kelly. This is Melissa Davlin with Idaho Public Television. I think this question would be for Dr. Turner. When we are talking about 30,000 cases potentially a week by mid-October, do you have any indication how many of those might be children who aren't currently old enough to be vaccinated?
Yeah, thanks, Melissa. Unfortunately, the projections that we're using are like statewide projections. They don't break anything out into age groups. However, given that what we're seeing in our data right now is that it's the younger age groups, case counts are increasing at a faster rate than older age groups, I would venture a guess that we would probably see a higher proportion of our cases being among children in the fall than we did last fall. I know that doesn't exactly get to what your question is, but that's the best information we have right now.
Thank you. And just as a follow-up, the 2,500 a week hospitalizations that would be needed, how does that compare to how many hospital beds Idaho has? And are we talking actual hospitalizations or just patients who might need to be hospitalized? And in a perfect world, we would have enough hospital beds for them.
Thanks, Melissa. I don't have at the tips of my fingers the number of hospital beds we have in Idaho. I can certainly follow up afterward with you on that one. What that is projecting is that would be the number of people admitted in a single day. So it would be on top of people who are already hospitalized for whatever reason. So these are called incident hospitalizations. I like to call them new admissions because I think that's a friendlier term. But that's what they're projecting is at the peak in one day, we would see 2,500 new admissions on top of whoever is already in the hospital.
Thank you.
And before we move on, Kelly, I'm sorry, I just want to make sure that we have a little bit of clarification because I believe, Melissa, you reiterated that Kathy's projections were for 70,000 cases a week by mid-October, but it's 30. So I just wanted to, in case other folks misheard the same thing.
Sorry, I thought I had said 30. Thank you.
All right, next up, Rebecca Boone.
Hi, Rebecca Boone from the Associated Press. Earlier during the pandemic, up until through July, I think we had National Guard service members assisting in primary care facilities and in hospitals to triage patients. And of course, we didn't have as many patients at that time coming in with COVID as we're anticipating in the coming weeks. Are there any efforts in the works to try to get more nurses or healthcare professionals at the state level rather than just competing with other states for federal, or to reactivate the National Guard to help with the coming surge?
Great, thank you, Rebecca. That's a great question, and you heard me say in the beginning that we have hospitals that are submitting requests for assistance, and we are certainly turning over every stone and leaf that we can find to try to figure out the best ways to get additional staffing into healthcare organizations, because that's typically the biggest strain that they're facing. Part of that may be, excuse me, putting a plea out to people in our state who maybe are retired clinicians that want to volunteer and reactivate their license. We're going to be focusing on that. So please consider this a call out to people across the state who are considering doing any kind of volunteer activity. I know the hospitals are desperately seeking people to step forward to help out. So we want to make sure we're getting messages out to get people recruited to do that. We're utilizing the Medical Reserve Corps and certainly the National Guard, as you astutely said last time. They were very effective in helping healthcare organizations do everything from testing to hospital disinfection to testing, vaccination, excuse me. So we just learned that at the federal level, Title 32, which helps provide reimbursement for the use of the National Guard, was just enacted. So that will certainly help. We are looking into the use of the National Guard right now. So I would say all of the above is on the table and being considered and trying to operationalize as we work with the hospitals across the state, including making requests for staffing to come in from across the nation. But again, as I mentioned in the beginning, we are in stiff competition with many other states. So like I said, looking for every opportunity we can.
Thank you. Next is Hayat Norimine. Now, I'm probably butchering that, sorry.
Hi, it's Hayat Norimine. I just wanted to check to see if there were any changes in the breakthrough cases. I understand that's been relatively low, but there hasn't been a whole lot of discussion on vaccinated people, how they can help protect people, and is there any new information on how likely they are to transmit the Delta variant to other perhaps unvaccinated people? And are you encouraging masks in public areas? Is that going to be part of your messaging?
Yeah, thank you, Hayat. I will take the latter part of your question regarding masking, and we certainly endorse the CDC recommendations for people who live in communities of high and substantial community transmission, wear face coverings in public settings. So we do endorse that. We do think that's a really prudent public health measure. And then in terms of the breakthrough cases, I'm going to turn it over to Dr. Turner or Dr. Hahn. I think I'll go with Dr. Turner first. Trying to read facial cues on the screen. Thanks.
Yeah, thanks. What I'll say, and then I'll turn it over to Dr. Hahn. She can maybe talk to you a little bit about the transmission risk. But Hayat, we are still tracking them. I will tell you that the risk ratios of vaccinated versus unvaccinated with regard to whether or not they become infected or they are hospitalized or their infection results in death have not changed a lot since last week. There's still anywhere between a 5 to 7 fold increased risk of those events happening if you are not vaccinated. And I'll go ahead and let Dr. Hahn maybe speak to, I think your question was about risk of transmission.
Yeah, thank you, Kathy. Yeah, so first of all, as Kathy said, it's really important to note that the data is still strong for these vaccines, despite the evidence of waning immunity for infection. One thing the studies support is that they still are preventing, even in those populations where it seemed to be waning, that they protected against hospitalization and death. So these vaccines are still performing incredibly well. The transmission risk is not completely clear. We know Delta is more transmissible in general, of course, and it looks like in vaccinated people that do get infected, although that's a less common event than an unvaccinated person. Some studies have shown that they have high loads of virus in their nasal passages, where we know, in theory, that would mean that they might transmit as easily as an uninfected, non-immunized person. Excuse me. But the other thing that has been shown is that they tend to clear that a lot faster. So they get infected, their virus goes to town, but then the immune system does kick in, and these people, when you follow them day by day, the viral load drops off very quickly. So even though that is not proof, the most experts think that they are probably transmitting it less than a vaccinated person. Nonetheless, that data is the type of, than an unvaccinated person, that they're less likely to transmit. But that data is one of the reasons that CDC, again, recommends the masking for vaccinated people, when they go out in public settings. As Elke mentioned, we support that strongly. I have gone back to wearing a mask when I'm in the grocery store or in a public setting because I don't want to risk the fact that I could have asymptomatically be transmitting it to somebody else. So that is the current recommendation. And we think that's super important if we are to get a handle on this and protect our hospitals.
Thank you. Next up, Shira Matsuzawa.
Thank you, Kelly. With the increased cases and hospitalizations, at what point do state healthcare leaders like yourselves make recommendations to the governor about possible statewide mandates or perhaps going back a stage, or have those recommendations already been made?
Yeah, thank you. We do talk with the governor's office, of course, continually. I think we speak almost every single day. We review the data with them. And the governor, as you know, as he said in every press briefing, his concern remains are preserving that healthcare capacity, making sure that kids are back in school for in-person learning. So we do provide all that information to him, and he's very supportive of making sure that we're giving the hospitals every support measure that we can. And really, we have really great tools at our disposal to make some of these changes. And the biggest tool that we have in our chest right now in our toolbox is to increase our vaccination rates. And in addition to encouraging everybody to follow those recommendations around masking. And we know that it's incredibly challenging, and it seems like when you're out and about in communities that things are back to normal and there isn't any concern, but that's not what the data are telling us. And so if we can do everything in our power collectively as media represented here to help us get out that message, that those are very effective tools to help change this trajectory. So we know that those are messages that the governor really pushes forward, as well as trying to increase our vaccination rates and encouraging people to wear masks and do the physical distancing.
Thank you. Sorry, just real quick, but is there a certain point, like a certain case count, or I mean, we were talking about 30,000 by October. I mean, is there a certain point where you would strongly recommend maybe we do go back a stage or something to that extent?
Yeah, and to continue on, as I mentioned, we do continually review all of the metrics that we've had in place since day one. And he is, taking all that into consideration. And certainly, as we look at our healthcare capacity and consider, the stage that we're in with healthcare, and if we are indeed, having to move to crisis standards of care, those would all certainly be some game changers. But those are ongoing conversations, and of course, we make all of those recommendations along the way.
Thank you.
All right. Next up, we have Jack Schemmel.
Hello, I'm at the KMBT Twin Falls. I'm just wondering, I know the past day, at least Twin Falls County had the most cases throughout the area. What conversations, if any, have you guys as health officials had with people in the area, health officials in the area, the Magic Valley, and stuff like that?
I'll kick it off and then maybe turn it over to Dr. Turner again or Dr. Hahn. We have multiple calls a week with our local public health partners. We review all of the data at our disposal. They also have their own data and information. And so I know that they too have been working locally to get messages out and using social media and working with their partners to do that messaging. But I will turn it over to either Dr. Turner or Dr. Hahn to see if they have anything they want to add.
Thanks, Elke. This is Kathy. The only other thing I'll add, and then I'm sure Dr. Hahn has something to add too, is that we're on the phone with our the people who do the disease investigations and oversee the epidemiology programs in the health districts on a daily basis. And part of what we do is we talk to them about, do they need help? What kind of capacity constraints do they have? What are, what we can do to support their efforts, because they're really doing the on the ground work with regard to investigation and contact tracing. So our job here at the state is to support those efforts at the local level. And we are in constant conversations with them. So I know you asked about leadership, but it does bubble up to leadership. And I'll ask if Dr. Hahn has anything to add.
Yeah, thank you, Kathy. I'll just add to your specific question. We just got off a call with them, all the hospitals from noon till 1. We heard from hospitals around the state and shared ideas and resources, and came away with some other thoughts, things that we could be doing more of. We do need to continue to communicate strongly about the two things that Elke emphasized, and that is very important. We know to the governor's office, that is vaccination, the continued need to continue to encourage people to get vaccinated, that these vaccines, even though, yes, you may eventually require a booster, but the Delta is here, and we really encourage people who are on the fence or waiting until the right time. There's growing and strong safety data on these vaccines now, and we know the Delta variant is really taking Idaho and the rest of the country by storm. It's our best tool. The second thing is that we need to continue to strongly encourage people to wear masks in public places, whether or not they've been vaccinated. I was commenting at the stores that I go to, I feel like compared to a year ago when things were bad, fewer people are masking right now. And I feel like our challenge is to even get the message out, how worried we are and how serious we think this is, and that we need to go back to those same tools we used before. So masking and social distancing. What we have in addition that Elke alluded to, and I know that the governor feels is our best tool, is vaccines. We didn't have those a year ago. And I think that's one reason why the governor's office and we feel that we should be able to keep businesses open and society open, because we have tools we didn't used to have that are very protective, and that should be helping us in this very difficult time. The hospitals are telling us that they need staff. You know, that's their biggest problem, as Elke mentioned already. There aren't a lot of staff to be found. People are already employed, or they are not, don't have the skills that are needed. So that's a big challenge. We are also working with the hospitals. We've had earlier call just this morning with the Idaho Hospital Association to talk about increasing use of the monoclonal antibody treatments. You might remember those, but they're not. Is there a way we could step up use of those to keep people out of the hospital, keep people from getting as sick? So we are exploring all avenues, not just the vaccine and masking, but also taking the burden, keeping people from getting as sick if they can get treatment with monoclonal antibody. Also people who have recovered, trying to get them safely out of the hospital so we can preserve beds for those who are coming in with COVID.
And sorry.
Your follow-up?
Yeah, just with you mentioned the lack of maybe masking in areas and students going back to school and less social distancing. Is there concern about other common colds kind of being more apparent this year, like RSV and stuff like that?
Yeah, I'll take that, because I actually just was. Thank you for asking that question. We are very concerned. Apparently you've already heard respiratory syncytial virus, or RSV, is already made an appearance in Idaho. We have kids in the hospital with RSV now. That is very unusual, and not only in Idaho, but Texas, I think, is the most prominent in the media, that they've had quite a bit of RSV. This is very serious viral infection that affects young kids. We don't understand it, but it showed up early. We did not have RSV last year. Like influenza, there was very, very low activity, probably due to some of the mitigation measures that were put in place for COVID. So this virus is outside of its normal cycle. It's acting differently. We might see the same thing with flu. And so we are very concerned as we get into what we call respiratory season. So flu season, RSV season, which are both usually in the fall, winter, that they're going to be another challenge. And we know that masks and social distancing will help prevent that from happening as well.
Thank you.
Thank you. So anyone who still has their hand up, if your question has been answered, please lower your hand. We will continue to take a few more questions. Audrey Dutton.
Hi, can you talk a little bit more about the request for federal assistance? Elke, how tough is the competition for these limited resources right now? Is this situation with competition for staff different from how it was last year? Like, can hospitals tap into the same resources, or is there more competition? Because it seems like there are surges all over the country right now.
Excellent question, Audrey. Thank you. We have put in, we're in the process of putting in a federal, it's called an EMAC, an Emergency Medical Assistance compact request that we have already been kind of interimly told that it's going to be tough to get any federal resources because all of the states we're seeing this ubiquitous surge across the entire nation. And as you know, in some of the states, it's an even worse situation with higher hospitalizations, and all hospitals are really, really struggling right now, keeping enough staff on board. So we don't know exactly. I can't quantify it for you right now. We're in the process of exploring that and making that request, but as a preliminary answer, we've been told that it's going to be very, very tough, and it is a lot of competition. So we're in competition with states that are faring worse than us, so it's going to be a bit of a challenge. So, but we're not. That's not to say that we aren't going to do anything. We are going to do everything we can in our power and authority to bring in any resources that we can to our hospitals here.
So just a quick follow-up then. How how do you see things panning out in mid-October? I mean, are we really close to crisis standards then?
That's a great question also. We are very concerned. As I mentioned in the beginning, we're standing up our Crisis Standards of Care Activation Committee to train them up and to refresh them on the protocols on what do we do when we can't bring any staffing in. We have to, as a society, figure out the best way to stop the flow of patients coming into the hospitals because they're so resource constrained, which is why we're really trying to get these messages out today about the importance of doing those measures we know that work. So yes, we are concerned. We think some hospitals are saying that if this trajectory continues, they will find themselves in that situation needing crisis standards of care in as soon as 2 weeks because their staffing is so constrained. So we are at this point pleading with people to take those measures to make sure that we can stop the flow of patients coming into the hospitals.
All right, next up we have Heatherann Wagner.
Hello, Heatherann Wagner, KPVI. What, if any, additional guidance is there for vaccinated parents with unvaccinated children under 12?
Dr. Hahn, do you want to take that?
Yeah, sure. Yeah, thank you, Heatherann. So yeah, we hear daily from parents who are very concerned about their unvaccinated children, especially now with going back to school. So the best recommendations that we have right now, if you have kids who are under 12, because we know that vaccine is not right around the corner. It may not be for several months before we see a vaccine for that age group, is to, again, encourage your child or require your child to wear a mask when at school or in other public settings, or face covering, and to as best as they can. And we understand that in schools, kids are not completely in control of what they're told. You sit here, and but as best they can to socially distance. One thing, I just had a conversation with a mother earlier today. She said, boy, my school's doing a good job with masking, but then they go to the cafeteria and they're all crunched in there and they're taking their masks off and eating their lunch, So I totally understand that there are challenges to safely going to school, but for the child and to work with the child's school also. I have another caller that I talked to last week who's the school. She was worried the school wasn't doing everything they could. And so she was speaking with the principal and trying to ascertain. I think sometimes the schools don't hear enough from the parents who want to see, measures taken. And I think it'd be very helpful to talk with school leaders about the safety measures in the school. And I don't know if you want more than that, but those are the kind of things that I tell parents when they call me when they have young children and they're just concerned because they haven't been able to be vaccinated. And of course, if your child has special health concerns or is at high risk of severe COVID, you can certainly talk to your pediatrician about is it safer to have that child do homeschooling or online school or something like that for their protection.
Thank you.
Thank you. So next up we have Vinny Del Giudice.
Right. Vinny Del Giudice at Bloomberg News and then following up on the hospitals, the staffing issues, how many staff are actually falling ill? And beyond the staff, what is the situation on hospital beds and ventilators? Can you give some examples? Are the problems rural hospitals, metropolitan medical centers? And finally, are you sending anybody out of state to Denver, Salt Lake City, what have you? Thank you very much.
Thank you. Sorry. This might be a bit of a team effort. I'll start out here. With the staffing issue, I can't necessarily quantify the number of staff that we're seeing in hospitals out sick, but we know that that is a substantial issue as we're getting these or having these conversations with hospitals. They're seeing staff out because they're ill, because they've been exposed, and then another subset for certain are out because they are completely burned out. And we're seeing healthcare professionals leave the profession to do other jobs because the stress and the demand has been so high. So to quantify the numbers, I can't tell you that off the top of my head, but we do know that it's substantial. I can tell you that one hospital in northern Idaho told us that they have 500 open positions at this point in time. They normally run around 200 positions open. And they're not a hospital that's requiring vaccinations or anything like that. It's simply, remember, the staff that exist in hospitals are also community members, and they are typically reflective of what you see in the communities in terms of cases. So it's a mixture of the two. And then in terms of hospital, I think you asked about ventilators and ventilator capacity. I believe that we have sufficient hospital beds for the most part and capacity, but the issue is always staffed beds and staffed equipment to make those available to the patients that are coming in. So again, I can't necessarily quantify that off the top of my head right now, but having not enough ventilators at this point in time is not the issue right now. It's really the staff, the respiratory therapists, the nurses, the ICU capacity that are causing the issues. And Dr. Hahn, I see you poised perhaps to add to that.
Yeah, thank you, Elke. In particular around ventilators, I have two messages. One is, as Elke said, if you go on our dashboard, we do show the number of ventilators available in the state. And as of today, we have 544 ventilators available. So as Elke said, it's really more about the staffing than about the equipment right now. It's about having enough people to, that doesn't mean that our state could manage 544 people on ventilators, but the actual equipment is there. However, we were told today that we have 65 people in the state who are on ventilators because of COVID. And 65 is more people on ventilators than we had during our winter surge at any given day. So we are already beyond where we were as far as ventilator use due to COVID last winter. So very concerning statistics. Again, we have enough ventilators per se, but the fact that the numbers are actually as high or slightly higher than they were last winter is very, very concerning.
Thank you very much.
Thank you. Next up is Kyle Pfannenstiel.
Hi, this is Kyle from the Post Register. I wanted to ask about your model, Dr. Turner. What countermeasures can public health officials take on a local level to prevent us from getting to 30,000 cases a week?
Yeah, thanks, Kyle. And it's not my model. I just want to make that very clear that I am not the modeler. This is a public model that was developed by the COVID-19 modeling project. It's available to the public. But I think we've already covered what those mitigation measures are, which is, we need more people vaccinated. We need people to be wearing the masks, socially distancing, staying home when they're sick. That is a key. Please stay home when you're sick. We are seeing some respiratory viruses circulating. And then, of course, to wash your hands often, to keep your and not touch your face. So I mean, I don't have much to add to that. That those measures are not, the models do not always account for the the public health measures. Some of them do, some of them don't, and then when they pull them together, you kind of get a mix. So, but those are the public health measures, and we're going to continue to hammer those.
Okay, next up, Kevin Richert.
Hi, this is Kevin Richert from Idaho Education News. I wanted to follow on, this kind of follows on Kyle's question. If we're talking about 30,000 cases potentially according to the modeling in October, and vaccinations that take several weeks to kick in and become effective, are you almost at the point of no return here? I mean, can vaccinations really make a difference at this point?
Yeah, I'll start with a little bit, and then I'll turn it over to Dr. Hahn and Dr. Turner. Yes, I mean, we know that the vaccination is incredibly important. I also want to emphasize that we also have another tool we haven't emphasized as much, which is to get tested. As Dr. Turner was talking about, when you get tested, you know that you're positive, you can stay home. You can mitigate that spread of COVID if you are sick. Even if you're not feeling particularly poorly and you still have COVID, you can still mitigate a lot of the disease spread. And I'll turn it over to Dr. Hahn, because I want to make sure I mention the testing piece and talk about the rapidness of the vaccine.
Yeah, thank you, Kevin. You know, you're right. The getting vaccinated today isn't going to help us tomorrow, but this is the long haul. This virus, it doesn't seem like it's going anywhere fast. We do need to continue to try to get folks vaccinated because we're going to need that help in 3 or 4 weeks and 5 weeks when those vaccines start to really be effective. In the meanwhile, we're working with schools. I don't know, I can't remember if I mentioned already, but just yesterday I spoke to the Coeur d'Alene School Board as they make their deliberations about what they're going to be doing. And we are giving the same messages, and I know the local public health districts are as well, that we recommend everything they can do to keep those kids safe. So vaccinations for those eligible, working with parents to educate them about the vaccine, masking, social distancing, et cetera. So we really want to keep those schools open this fall and keep the kids healthy and safe, and the staff.
Thank you. Next up, Zack Kellogg.
Hi, yeah, Zack Kellogg from KLEW News in Lewiston. Elke, earlier you mentioned that you referenced a hospital in northern Idaho that had about 500 open positions at this point, when they normally have around 200. In what area could you say is this hospital, and is this kind of numbers kind of consistent around the state, or starting to get to that point around the state of being more than double of the open positions that you usually have at this point in the year?
Yeah, thank you, Zach. I will say it's a larger hospital in northern Idaho. I don't know if they've come out publicly and said exactly that, but we are consistently seeing that in hospitals across the state, larger and smaller. Typically, I can say we were in a conversation with a smaller eastern Idaho hospital that had 50 open environmental services positions. Those are the people that go into rooms and clean the rooms and turn them over and do some of those activities and the disinfection. And so we're seeing it across the board. A larger hospital here in the Treasure Valley told us earlier this week that they have, they're down 40% of their environmental services positions. So it's ranging from positions in hospitals, from environmental services to food worker, or the people working in the dietary department, to, as I said, CNAs, RNAs, people working in pulmonology, to a respiratory therapist. Sorry, that was the word I was looking for. To physicians. It's running the whole spectrum of needing staff at all levels to really help them keep things open and moving forward.
Awesome. Thank you so much.
Mm-hmm.
Thank you. We're going to go back to Rebecca Boone.
Hi, thank you. Rebecca Boone, Associated Press. We've talked a lot about the staffing vacancies and issues at hospitals. Could you talk a little bit more about staffing at doctors' offices, primary care and urgent care facilities, or pharmacies where some of these important first steps like vaccination and testing actually occur? I'm wondering if there's a concern that a lack of staff there could lead to kind of a double whammy of flu and coronavirus vaccine administration issues.
Yeah, thank you. And I haven't heard as much from physicians' offices and pharmacies as much as we have heard from hospitals because we have those routine conversations with them, and they're seeing, you know, kind of the sickest of the sick, of course. But I know that anecdotally we have, you know, I have heard that from healthcare providers across the state that, of course, just like every industry, they're seeing, you know, staffing shortages and people out ill or taking on other roles, for example. So I don't have any quantifiable information for you, but certainly as community transmission increases and we see more cases, it's going to trickle into all areas if we don't really turn this trajectory around.
Thank you. And just a follow up to that, if I could, on the vaccine issues, we heard a little bit earlier about this year, or earlier this year in other states, about a potential needle shortage for the needles used in the vaccine, which are apparently also the same size needles that we use in the flu vaccine. Has that been an issue at all in Idaho? Is the allotment of needles that we're getting from the federal government along with those vaccines adequate for our needs? And then also, do we have enough vaccine stockpile in the state to handle boosters for those who might need it in coming months, and also the immunocompromised people who might need that third dose? Thanks.
Yeah, thank you. And you've teed this up nicely to bring Sarah Leeds into the response group here. So Sarah, hopefully you heard all of those questions and you can address them for Rebecca.
Sure. I may need to ask Rebecca to repeat one or two, but the stockpiling of vaccine, we don't store the vaccine at the state at all. We process orders for providers. We're doing that weekly, so providers can keep the inventory kind of at the level they need. But there are lots of doses available, both Pfizer and Moderna. And as you all know, I think you all know that we still are not able to order any Janssen doses right now because of the FDA approval of a manufacturing facility in Baltimore. So right now we order Pfizer and Moderna. We do have inventory of Janssen in the state still, and that has not expired. And our providers are administering that. So we have vaccine supply is not an issue. It should not be an issue in the coming weeks and months. The needle supply, we have not heard the needles that come, the ancillary supply kits that come with every vaccine order have had all the needles that they are supposed to. I have not heard about a supply issue as yet, but it is something that I want to pay attention to, because as you all know, flu season, influenza vaccination season starts in just a few weeks. So, many providers will be administering flu vaccine, and we want to make sure that they have the supplies they need. But again, I have not heard of a shortage of needles. But it is something we are paying attention to. And I don't remember if you had a third question. So if you did.
No, that was it. Thanks so much.
Yeah, you bet. Thanks.
All right, thank you. So remember to lower your hand if you have had your question answered. Hayat, we'll go to you now.
Hi, I just wanted to ask, so in the latest survey of obviously a large portion of Idahoans had said they'd never get vaccinated and, seemed like they wouldn't change their minds. I was just wondering, what are you seeing now? Are you seeing vaccine uptake increasing due to the Delta variant? Have state and public health districts made any adjustments with messaging in the past year, and what do you see working?
Yeah, at the beginning of my presentation, I talked about the age group that we have seen we've seen some increases in. I talked about we have seen a week-over-week increase in some of those doses being administered, probably driven a lot by concerns about the Delta variant. But even though we've been seeing that increase in doses administered, the rate of that growth has certainly tapered off. But those groups we've seen the highest rate in, recently have been people aged 12 to 17, which is likely driven by back to school vaccination series, knowing that it was right around the corner. People aged, sorry, excuse me 1 second, let me scroll down here. So 12 to 17-year-olds have had seen an increase. People aged 35 to 44, we saw a bit of a higher increase compared to others. And people aged 65 to 74 were the groups that I had mentioned earlier in my presentation is what we're seeing. Now I've forgotten the latter part of your question, as I was trying to go back through and find that data really fast. Can you repeat the second part of that? I'm sorry.
Sorry, yeah. I just had a question about what's the state doing in terms of messaging? Has there been any difference in what you're saying and what's been working?
Yeah, thank you. Sorry about forgetting your question. So we are continuing with our messaging on a statewide basis, and we have our public service announcements that are out there. We have recently one that's circulating, kind of a back to school message. We're using stories of real Idahoans and their voice and why it was important for them to get vaccinated. We're continuing to work with our peers in the governor's office and other public information officers across the state with the local public health districts. Kelly Petrov has been very involved in all that and working with our partners and helping develop those messages. But we know we need to do more also. We know that this is a really important juncture where we've got to make sure that we're getting those messages out there. We're using social media, we're using these venues, we're increasing these conversations to every week now. So we'll have more opportunities to talk to you all and make sure that you understand what we're seeing in the state. Again, more can be done, and we're working with our partners to increase those messages and really make sure we're getting out the facts about vaccinations and trying to dispel any of those myths that continue to be pervasive.
Thank you. And just a quick follow-up. Dr. Hahn had mentioned there were 65 ventilators in use due to COVID, and that's more than any given day during the winter surge. I was just wondering if she happened to have the number of that was the highest during that surge.
Yeah, thank you, Hayat. Yes, there were several days in November and December where we had 63 ventilators in use due to COVID reported by the hospital. So we're just eking above that.
Thank you. Since we've gone 30 minutes over, we're going to take one more question and then we're going to close it down for today. I see Vinny has his hand up. Do you have another question, Vinny?
I'm sorry, I'm tardy. I should have taken my hand down. My mistake.
All right, Audrey.
I'm still learning computers here. Sorry.
Okay. Audrey, you left out. You get the last question.
Thank you. Elke, I'm curious. Now that we're 18 months into this, how are you feeling?
That's a very loaded question. Tired, concerned, and I think all of us can easily say that we are all kind of overwhelmed and stressed out. I mean, it's been a long haul, and it's not just us in public health and responding at the state level. I think it's you all, it's our family members. We're all over it. We want this to be done. So I think that's also underlying a bit of frustration that we do have these effective tools and measures that we can take, and but also acknowledge that everybody has different views on things and different belief systems and value systems. And so I think if we can really focus on setting up that good kind of infrastructure and statewide kind of community support, rallying to support each other and being effective, society members, that we can really turn this around if we all work together. So I guess I'm always an eternal optimist. I will continue to believe in people and doing the right thing, and I'm so proud of all the people that have taken those great steps to protect themselves and others. And I know that there are more people out there that have that capacity. We just need to find the right thing that really helps them kind of step over that line and motivate themselves and others that they live with and work with, and to take that step and help each other out.
Thanks, Elke. I want to thank everybody from the media for their time today. Of course, Elke, Dr. Hahn, and Dr. Turner, and Sarah Lees for their time. We really appreciate it. We're going to wrap up for today. Just so you all know, we are planning another media briefing next week, Tuesday, August 24th. We are going back to weekly media briefings. So thank you for joining us today. I'll send out the information later this week.